But after recording, I don't see most of us acting on it. Yes, sometimes we do, but most of the time we don't act on it. And this is what it's showing here, that out of these 3,000 patients, only 17% of the patients' plan was changed and they were rescoped within 3 years. I think 3 years is far too long. If you take 1 year as optimal, if it's suboptimal bowel prep and you want to repeat, you should be repeating at least within a year. And only 216 patients out of 3,000 had a repeat colonoscopy. That's because we don't give a damn. We think we're too busy, I can't afford it, waiting time, all those logistic, practical issues, I fully agree and understand. But we need to change that practice. And the people who had repeat colonoscopies, were mainly those in which the endoscopist failed to reach the cecum, or where he detected lots of polyps, because there you worried. So when you don't detect polyps, or you got to the cecum, generally people don't change the decision. So this tells me that poor bowel prep is quite common. Most of the time we do not repeat that colonoscopy, we just ignore it. We record it and we move on. So they then looked at in this study to see those patients who did have a repeat colonoscopy, what they found in them. And what they found in those patients who had repeat colonoscopy was a miss rate of adenoma of 42%. I think that's a bit too excessive, but that's incredible. There might be selection bias, there might be some other reasons here, because it is a retrospective study, but still, that's a big, big number. The important thing is, where do we miss these lesions? Is it in the left colon, in the right colon? Doesn't make a difference. We miss them in the left and right colon. And the most important thing is, it's not tiny little things. Even adenomas more than 10 millimeter in size were missed in 27% of these patients. So that's very important. Poor bowel prep is common, we're not rescoping, and when we rescope we find a lot of these, so we need to think about it. And we can't afford to miss all these significant pathologies. Based mainly on this data, the American Colorectal Cancer Screening Body issued the guidelines in 2012, which clearly say that colonoscopy should be repeated within 6 to 12 months of poor bowel prep. So they have some sort of working principle now, that's how they work based on this. But again, it is subjective. Now, what do we have in England? I'm not going to tell you. Everybody doing colonoscopy here knows what we have. Anybody who's still using the sodium phosphate should think very carefully, because I think there's a big FDA warning on it, and most units have stopped using because of the nephropathy related to it. We use Picolex, and we've been using that since 30 years, since Roger's time, I think, or even before. I don't know how long.